I'm Dr. Jeff Summers. I'm Medical Director of the Department of Psychiatry here at Enrico Dr. Parham Hospital. Well, depression is more than just feeling sad. Depression is a pervasive feeling of feeling down, feeling sad for at least a 2-week period of time, with accompanying symptoms of depression that would include a lot of physical type symptoms: low energy, difficulty focusing, difficulty concentrating, changes in appetite, changes in sleep. And I think there's been a tendency in the past to think about depression as a syndrome of just something from the neck up. But depression, as we learn more and more about it, really is a systemic disorder with not just psychological type symptoms, but physical symptoms as well. The more and more we research depression, the more we are discovering that there can be a genetic predisposition for depression. That's not always the case. Depression can arise spontaneously in a family, in an individual in a family. Frequently, depression does arise in the context of stressors. And it may not just be one stressor that's formidable, but it may be one stressor heaped on top of another, and the chronicity of the stressors, one stressor on top of another and lasting a long period of time, that can be a trigger for a depressive episode. I think it's real important that when we diagnose depression, that we pay attention to it not being a situation of a person just being sad. We all feel the full range of emotion. We all respond to events in our lives. But we're talking about a syndrome where there's pervasive sadness with the accompanying symptoms that I mentioned. And then I think it's best to be evaluated by a professional such as a psychiatrist. And now we also have depression rating scales, which can be very, very useful in us diagnosing depression as well as the severity of the depression, as well as monitoring response to treatment.